This is Bill. Bill loves his dog and to play with animals. Bill also loves coffee. It's his favorite drink. But you probably didn't know that Bill is HIV positive. This is the bloodstream. Here are your happy T cells, and they're just flowing all around in there ready to attack anything that tries to hurt your body. In a healthy body, there are tons and tons and tons of T cells. So many. But when HIV infects the body through the bloodstream, it will attack the T cells. So how it attacks the T cells is that, let's say we have here a very big T cell. HIV is able to connect to its outside receptors, with its receptors mimicking the outside receptors of the T cell. So it breaks in, and then it uses the DNA of the T cell and messes it up, leaving its DNA. So then tons and tons and tons of HIV, technically not cells, viruses, leave, killing the T cell in the process. Beep, beep, burn. So, when HIV enters the bloodstream, it comes and all of these T cells die because it's all getting turned into HIV. So then the T cells aren't able to attack and handle the large increase in the HIV cells. During the first stage of the illness, the individual will receive at first flu-like symptoms. So that's sweating and having a fever, heat's radiating off. And then the flu-like symptoms will disappear in the second stage, and the HIV will be lying dormant inside the body. And the HIV can lie dormant for up to 10 years or more, about 6 months to 10 years. Then, once enough HIV cells have overpowered the T cells, a secondary infection will set in. So the secondary infection comes in and it also enters the body. And the secondary infection is technically what kills the individual. It's those symptoms that result in the individual's death, but it's due to the weakened immune system that the individual is able to have this secondary infection. Let's learn some more about Bob. Bob, tell us about yourself.
Hello, my name is Bob. I'm 66 years old and I'm a gay male.
As it turns out, these are the two main risk factors for HIV. HIV has an easier time attacking young and older individuals because of their weakened immune systems. So they have an easier time killing off all the T cells because they're already weak. And they run at higher rates in gay men because gay men participate in anal sex. Anal sex is a higher risk factor when it comes to HIV transmission. Dr. Brodus is here with us to tell us exactly how HIV is transmitted. Doctor?
Well, HIV can be transmitted through, or HIV is carried in the following bodily fluids: blood, semen, preseminal fluid, rectal fluid, vaginal fluid, and breast milk. Now these fluids have to come in contact contact with the bloodstream. But keep in mind that the bloodstream is any sort of tear or sore on the body that comes in contact with these fluids. That's why anal sex is so dangerous, and why HIV runs in such high rates in gay men is because generally in anal sex there are tears in the rectum membrane. HIV is also largely transmitted during shared needle use during drug use. That's because blood from one person remains in the needle and then is put into the second person's bloodstream. It's Bill again. I guess I just want to tell you some things I wish I would have heard before I found out I tested positive for HIV. First, the best way to avoid being HIV positive is to remain abstinent and to not participate in drug use. But since HIV still exists, even though that's been preached, I'll say some other ways. To always use protection during sex. Then, try and avoid anal sex. That is the highest at risk sort of sexual act. So if you can avoid that, that would be for your best interest. But if you continue to participate in that act and are using protection but are worried because it's not always 100% sure, you can, if you don't know your partner, that's something you should find out, talk to your partner, and see if they're getting tested. People who are sexually active should be tested every 3 to 6 months. And that's depending on your risk factor. Then, if you know your partner, and let's say you or your partner test positive for HIV, the HIV positive partner should be taking capital T, AS, capital P. And that will reduce the HIV in the bloodstream and make it less likely for HIV to be transmitted into your partner. And the HIV negative partner should be taking capital P, R, capital E, capital P. That's PrEP. That builds up the immune system and should very strongly help prevent contracting HIV, though it is also not a guarantee. The only guarantee is abstinence and abstaining from any drug use. Doctor, would you tell us about the stats around and about HIV? Sure. Well, this past year there were 6,721 deaths as a result of HIV. There were about 40,000 individuals diagnosed, new diagnoses, each year from 2010 to 2015. That number has dropped by about 3,000 since 2010 to 2015, but we're not really seeing the change we'd like to. That's still a lot of diagnoses, and though that's not a lot of mortalities, it's still more than we would like.
Here are some free HIV testing clinics near you. HIV is a very serious and lifelong illness. That's why you need to take the correct precautions to make sure that you aren't infected. Or, if you are infected, to make sure that you take care of your mental health and physical body with the right treatments and joining a support group.